Good afternoon, everyone. Welcome to today's webinar. The Future of Telehealth is here. Today, we're going to talk about how to promote safety, security, and patient outcomes through virtual visits. My name is Lisa Silverman. I'm going to be your facilitator for today, and it's my pleasure to introduce our speakers, Sean Griffin, President and CEO of URAC, Emily Woodard, one of our current clients who's with Teladoc, Greg McRae, who's on the URAC team, and you see myself up there in the corner right. Behind the scenes, these are several of the people who are going to be chatting and saying hello to you. So we hope they'll start by saying hello and what they work on for URAC. You can pay attention to them in the chat box. They'll be there to engage you, help answer any questions you have about URAC, and just help the conversation flow. A little bit about some of the tools we'll be using during the webinar today. First, we have our chat box, which is in the left-hand corner of your screen. Please say hello in the chat box and introduce yourself. Tell us where you're from, and tell us what you work on as it relates to telehealth. Below that, you'll see that we're going to have some polls for you to answer. We'll pull those up every couple of minutes to keep you engaged and to have you tell us a little bit about your work. Below that, you'll see some resources. We posted things that are relevant to this webinar, such as what we work on at URAC related to telehealth, including slides and a video of Sean and Aaron Turner Pfeiffer talking about the future of telehealth in a casual recorded conversation. And throughout the webinar, we'll have some prizes. So if you hear your name called, what you'll do when we do a prize is you'll send Laura Wood a private message with your address so she can send you off some URAC goodies. I'd like to open our first poll. We have 2 polls to get us started today. Our first poll is, why are you here today? Our second poll wants to know a little bit about what you're telling us in the chat box. For what type of organization do you work and what is your role? Sean, I'm going to turn the floor over to you in a minute, but you can see why people are here is really to learn more about the future of telehealth and to see what URAC is doing with telehealth. Somebody saying to get smarter on this rapidly developing area. So I hope we'll be able to do that. To learn about keeping a telehealth portal secure, to learn more about URAC offerings, which Greg is going to cover, to learn about how telehealth is growing. And I think, Emily, you touch on some of that in your talk later, hearing about what you saw in the field. Seeking guidance on tech-enabled telehealth. This is great. And can we see the responses to poll number 2? So we can see several of you, some of you got some private health. We have a good mix here. We have the people from hospitals, we have telehealth providers, we have health insurance, we have tech consulting, we have healthcare management system. This is the variety in URAC's clients that we talk about in the diversity. As promised, we have URAC goodies to send you just as our thanks for being here and being our partners today. For prize number 2, our random selection went to Katie Falcon. So Katie Falcon, please send a private message to Laura Wood so that we can send you some goodies. We can get your address and we'll get some goodies out to you. And with that, Sean, I'm going to turn it over to you to talk a little bit about telehealth before COVID-19.
Thank you very much. I appreciate it. I can tell you that we've had some competition for the URAC hand sanitizer little bottles. I think that you know, if nothing else today, if you win one of those, I would take it and sell it on eBay because you probably can make some retirement funding just with some hand sanitizer. So thank you for everybody coming today. I'm the president and CEO of URAC, Dr. Sean Griffin, and telehealth before COVID. I think it's really important that we saw telehealth before COVID, and it really wasn't doing that much. It was on this sort of slow climb, and it was starting out with some people were doing it. They're seeing it as an extension for things like neuro coverage in ERs, where you take a look at somebody who was having a stroke, those sort of things. But there were really a lot of different problems, a lot of challenges. If you looked at it, there was the state licensing requirements, there was lack of payment, the payers weren't covering it, the insurers weren't covering it very well. So not many providers were doing it. And so that's how we were going along. You know, we were very fortunate at URAC that we have been been seeing the value in telemedicine for several years, and we're seeing telemedicine, telehealth. Different people are using different terms for it, but it really wasn't facing the uptake in society until COVID hit. So if we go to the next slide. So all of a sudden COVID hits, and there is just this amazing opening of the gates. The congressional response with COVID, we can divide things into, before COVID, there was partisanship, there was fighting, there was bickering. They couldn't agree on anything. They couldn't agree whether it was a sunny day or a cloudy day. And then COVID comes along, and you have the public health emergency being declared. You have the gates being thrown open. You could do telemedicine if you could find a way to hook up a couple iPads, and it would get paid for. And there were three major bipartisan bills that went out. There were all of these waivers that went out to the states, expansion of telehealth coverage. Some people saw it as a way for people who were worried about having COVID to get seen and get their symptoms assessed. And so telemedicine was a way for consumers to do that and yet not have to go into a place where they were concerned about catching a disease. And all of these restrictions were sort of turned off overnight. I talked with some people earlier today who said that they saw their visits go up 4,000% in the span of a month, where it was just sort of a niche thing that they were doing in a couple parts of their hospital, to now where it became 90% of the primary care visits were all being done with telemedicine. And we've seen good programs, and we've seen some programs that aren't that good. And when you look at what's going on with the congressional response, they threw the gates wide open, and now they're going to be putting some restrictions back on it. I think that as you see things, we're located here in Washington, D.C., Congress, the payers, they're all going to say, okay, we've been paying for it, we've been covering it, but what's it really going to look like? What's the next version going to be? I've seen articles that say that telemedicine advanced, 10 years in usage in 2 months. Well, the states are going to put back some licensing restrictions. The CMS is going to put some restrictions back in there, but even CMS is saying that you can't put the genie back in the bottle. People have experienced the convenience, the availability that telemedicine provides, and they see this as a new way to access healthcare. And so as we go forward, I think that you can expect for some controls to be put back on, but it's not going to go back to the way that it was. And when an organization is looking at, what is telemedicine, I think that you're going to start seeing concerns about the quality of the telemedicine. You don't want your telemedicine to be a vending machine for pills. It needs to be, well-qualified people doing good work, checking their quality, making sure that they're doing it in the right way. And some organizations are not going to be able to step up to that plate if they don't do some more work on the infrastructure. You're going to see concerns about safety and security. CMS said that they weren't going to be particularly concerned about HIPAA violations, PHI violations if people had good intent. I think we've seen that, that's for a public health emergency. When the public health emergency declaration ends, there's going to be concern about it. And some people are going to be able to do it and do it well, and others aren't. So we're delighted to have Emily here from Teladoc to talk about their experience and the things that they have been doing, and why a program built around telemedicine is different than somebody dabbling in telemedicine because of the pandemic. So this slide talks about CMS's response. I think they put out 70 different waivers over the span of the public health emergency, turning off all the controls about origination, continuity of care, those sort of things. But when we start doing this again, I think you're seeing some promising comments being made about how telemedicine is going to stick around for Medicare Advantage. And that's really what CMS often uses as sort of a first step in expanding coverage under their programs, is to look at Medicare Advantage. So I think you're going to see the private payers and the federal government loosen up the restrictions. We're hoping and advocating on behalf of things such as telemedicine, allowing to be used for things like network adequacy calculations and availability of providers. I trained in rural Iowa, and out there it's tough to get providers anyway. And if telemedicine can factor into the equations as to what is network adequacy, I think that's going to be a game changer for a lot of underserved areas, both urban and rural, around the country. So with that, I will turn it back over to Lisa.
And Sean, let's continue this conversation here. So in the chat box, I would love for everybody to tell us kind of what conversations are you having with your team about the future of telehealth? We have all these different workplaces here, and we know that insurers are looking at it differently from how doctors are looking at it, from how obviously from how patients are looking at it, even from how regulators are looking at it. So depending on your role, your conversations could very well be different. Sean, do you want to chat about that and just kind of what the different perspectives that we've even heard about through the grapevine? I know you talked about it a little bit in the pre-recorded webcast that you did.
Sure. Sure.
And while that's happening, why don't we pull up the concerns that people have about telehealth and see what those are?
Yeah, one of the things that's important for us is we're located in Washington, D.C., and here in D.C., we get to talk to employers, we get to talk to payers, we get to talk to regulators, and they all recognize that this was something that needed to be done during this time of crisis. But there's concerns about fraud and abuse. Are there people who are offering telemedicine services who aren't doing a good job? Is it going to be used and exacerbate the opioid epidemic that we're facing? The employers are saying, we're paying for it because our workers need to have the coverage, but are we getting value for it? And what is the quality? I think even before COVID hit, there was a very interesting study put out by a good organization in the Northeast that said that when they looked at their telemedicine results, they saw that their providers were prescribing more antibiotics on telemedicine visits than they were in clinic visits. And is that a good thing? Is that a bad thing? If we are concerned about the overuse of antibiotics, if you can just get on the screen and talk to somebody who doesn't examine you and whose main goal is patient satisfaction and not high quality medicine, is that the best use for you? And is it really part of a program? Is there integrity to everything that you're doing? Or is this simply, like I said before, a vending machine where you can, pay your $20 and get on the screen with somebody who will write any prescription that you want? So I think that when you think about the employers, the payers, and the federal government, they see that there are good things in telemedicine, but there are concerns in telemedicine around quality and value and fraud and abuse that they're going to put some controls on to take a closer look at. So I think it's been a favorable view of telemedicine and the opportunities it provides, but I think there are some worries that have sort of come along for the road.
Sean, I'm seeing this John Horde in the chat box here. It's how do you measure the quality outcomes? How do we know that what we're doing is good? And how do we say this is good or this is good enough?
Well, I think that's an excellent question, and we have a huge advantage in that when you think about what's going on with telemedicine, the landscape has changed, and so we're actually getting ready to bring together national experts from leading organizations, both the employers, the payers, the regulators, and consumers, to say what is a good telemedicine program now that we're in this new world. And by that I mean, what are your guidelines for when is an appropriate telemedicine visit? You really shouldn't be seeing somebody for a telemedicine visit if they say they're having crushing chest pain and they're a 55-year-old male with heart disease. That's not the venue for that. So what are the rules about what makes a good visit versus not a good visit? Are you monitoring the outcomes of your visits more than just patient satisfaction? Are you taking a look at your antibiotic prescribing rates or your other prescribing rates? Are you looking at the clinical outcomes? Are you maintaining continuity of care? As an old primary care physician, I always worried about if somebody goes to a venue and receives care and that record never makes it back to their main office, then you've broken the continuity of care that primary care is based upon. Now, honestly, if you're going to somebody for, not to sound flippant, if you're going to see somebody for a toe fungus and they need to look at it over your iPhone and see what it looks like and write you a prescription and take care of you that way, that's one thing. But it's another thing to think about, are you going in and are you seeing people for post-op wound checks? How do you know if something is infected? How do you take a look at somebody's throat? How do you work with your providers to make sure that they have good camera side manner as opposed to bedside manner? I think that it's really an important point that we're at, where the new version of telemedicine is going to be built upon the experiences of the high quality organizations that we're going to bring together to update our standards.
Thanks, Sean. Sean, when we ask the question, what concerns do people have about telehealth? We're seeing, I'm looking here at our responses, 67% of people said they're concerned about government regulations. And these aren't going to add up to 100% because people could vote for more than one option. But we've got 67% concerned about government relations, 57% concerned about security, 37% about payment, 31% about professionalism. I know you've spoken about that in the past, and 39% about something else. So for the something else, I'd invite you to share that something else with us in the chat box. But Sean, what are your thoughts here? I mean, with 67, 2/3 of our people saying they're concerned about government relations, we're in Washington, D.C. We hear this stuff. This is the stuff that we live. What's your take on that?
Well, I think the government is appropriately concerned. I would say that a little bit. This reminds me a little bit of contact tracing apps and those sort of things for keeping an eye on coronavirus. I was a CMIO for about 15 years dealing with technology and those sort of things. And right now, because they loosened so many things, there are really cruddy platforms being used for telemedicine. And they would never be normally used, never be allowed. They don't have the security. I mean, when you see about Zoom meetings of city councils where people are Zoom bombing and jumping into the conversation, what's the security of the platform? And basically CMS said during this crisis, we're not going to be concerned about that. Anything that you can string together a couple iPads is going to be good enough. Well, they're going to put rules on controls as to PHI. What is a secure platform? Do you record it? Do you not record it? How do you obtain consent? There's some really sloppy things being tolerated right now. One of the biggest things is the whole licensing challenge. Do you have to be licensed where you're seeing the patient, or do you only have to be licensed where the provider is? And how do you handle those rules? Every state had different rules, and that was one of the challenges that we're faced, was the patchwork of regulations and how you handled those things. And right now, those things don't matter. Well, those are going to come back. And the federal government opened up the gates, but the states are going to be one of the places where the gates are put back on, because states have generally controlled their own licensing and care rules. And so we're going to have to see about what sticks around. And the federal government may say some things are okay, but maybe your state says it's not okay. So that patchwork is going to come back if the federal government doesn't set mandatory rules that apply everywhere. And even then, states like to control their licensing. Every state has a licensing board, and some are very particular about who can practice within their territories.
So, Sean, something to think about as we keep going. And Emily, I think you'll address some of this. We're having great questions here, and we can engage them in the chat box. I see some of you have answers to them. One of them is broadband access. And somebody else is saying return to work authorization. What rules? Testing. What about using Zoom? So I know some of you are answering each other in the chat box, which I love seeing. Emily, I want to turn it over to you because I think you actually touch on some of this at your work at Teledoc.
Yes, Lisa, I do. Thank you. I'm grateful to be here for the opportunity to share a bit of our quality story. It's absolutely one of my favorite topics to discuss. I would like to do a brief introduction about Teledoc Health, just so that everyone's familiar. We offer, Teledoc Health offers a comprehensive suite of services, including everything from expert medical services to nutrition and back care. We operate in many countries and in many languages. To date, we have several million consults under our belt, so we have some experience to work with. We strive to stay aligned with the 6 dimensions of care as defined by IHI, although quality of care has really been core to our corporate strategy from the onset. We have several accreditations, one with ACCME, another with NCQA for credentialing, and more recently with HHS for our patient safety organization listing. We are at least currently the only patient safety organization listing that's specific to telehealth, on top of our URAC accreditations. Can I change the slides?
There you go.
Okay, so our quality structure is balanced with strong commitment from leadership, which I think is critical to success. And you see this throughout our structure, and it's our infrastructure is heavily dependent on it. So you see it's evidenced by Lou Levy as our CMO, and he reports into a subcommittee of the board that's led by Senator Bill Frist. I don't know if you've had the opportunity to hear him speak, but he's widely known for his passion for healthcare quality and for doing the right things right, which makes my job very easy. And I'm grateful for that, because they really lead the charge with several items, including 2 AHRQ grants in which we're working with both USC and Harvard. And they're continually pushing the quality needle with innovative approaches. And COVID required some innovation for sure. The approach shifted so drastically and so rapidly from being episodic care for cases that were a little less complex into an immediate public need for access to care outside of the traditional setting. We suddenly became, it became very important for us to protect patients from exposure to healthcare settings and to protect healthcare workers from high-risk patients who could be managed from home. So although our consult doubles almost overnight, actually 85% of them were either the same routine consults or questions about chronic conditions with people who would typically have gone into a PCP office and were either unable or unwilling. We did have, obviously, an increase in calls with COVID concerns and a need to rapidly screen them, and public reporting obviously was a huge challenge. So on top of the increase in calls and the change in perspective, we had a few oddball things, and I've seen some of those come through the chat box with isolation notes and return to work notes, provider credentialing when we needed to bring additional providers on for the additional volume. So there were stressors in multiple departments due to the nature of the COVID complaints and the problems that we were facing with that increase. So we had to pull together really quickly and make some adjustments. One of our values as an organization is to keep our promises. So that was really important to us, and we needed to be able to move quickly to continue to do that at the scale in which we were operating. So I like to talk about that, and I have a lot more to say, but I think Sean's going to talk some about safety and security first.
Thanks, Emily. So Sean, in the chat box, we're seeing that people are concerned about Zoom and safety and security. So this is actually a perfect time to turn it over to you. And Stephen, I think in that comfort level as well. So you're on up.
Okay. Well, in my time as a CMIO, I think that anybody who was involved in EHRs knows that there came to be a process where an EHR would be qualified, would be reviewed, and its safety and security would be evaluated by a third party. And when all of this came about, I was looking at the chat box and it was talking about no, Zoom's okay, no, Zoom's not okay, Zoom Enterprise is okay. There are going to be regulators who are actually going to go out there and they are going to say what is a secure platform. And telemedicine sort of existed as its own little island on the side for a while. But I think as this comes back and as you start seeing the regulations, if you're not qualified to do telemedicine according to probably the federal government, then you're going to be boxed out of this. And you're going to see everybody move to those platforms. And I think one of the things that really is interesting is that telemedicine for a decade existed as how do we technically accomplish this? And that debate started back before everybody was carrying a video camera on their phone in their pocket. And when to talk about technology, I have to tell you, I grew up out in rural Iowa. I'm part of that map when they talk about coverage where there isn't even cell coverage, let alone broadband, let alone the ability to do video visits and those sort of things, which sometimes in the cities you act like everybody has broadband. But the barriers to the technology being available, I think we've answered those in a lot of parts of the country. And now that we've had exposure to the convenience, the question is going to be, what are the safe platforms? But you're making a mistake if you're only focused on the technology platform, because a safe platform delivering bad medicine is still end up being bad medicine. And we really need to say, we're going to see the platforms that are allowed. Some of them are not going to be allowed going forward. Some of the things that have been cobbled together, those will get disallowed by the federal government. Patients sometimes don't know whether they're in a safe platform or not. And that's going to cause some issues there. You can't always trust the good housekeeping seal of approval. And that's one of the reasons why I say that very often the regulations set the bar for minimum safety, but I think accreditation sets the bar for quality. And that's why we're working to say, it's not a matter of, oh, look, we can do telemedicine, but we can take care of you. We can do medicine and we use this platform. And I think that that's what we're seeing is that telemedicine is no longer going to be about the tele, it's going to be about the medicine part of it. And
Sean, thanks so much for that. I caught that and I put that in the chat box. What you said of a safe platform delivering bad medicine is still bad medicine. It doesn't quite matter how many bells and whistles we put on. If we can't diagnose correctly, we're going to be in some trouble there. And we're not going to see those positive health outcomes that we want to see.
yeah, I mean, not all convenient care is good care, and so just because we can do it, I mean, now there's some fantastic usages of it, and I think that there's some people doing fantastic work. But when you're just concerned about the access and the convenience, and you lose sight of the quality, I was afraid before COVID happened. I said one of the things you're going to see is telemedicine is going to have some terrible episodes happen. They're going to get the spotlight shine on them from bad things that happen, and then all of a sudden the regulators are going to rush in. Well, you had this massive pandemic happen, so everybody rushed in, and now they're starting to say, well, what about the quality? Okay, we survived the disaster, but now what do we do going forward?
So, Emily, let's turn it over to you. What are you doing about this? We're hearing that we need, Nancy's telling us that patients need education, Ken's saying that providers need education. You're going to talk to us about patient safety and what Teladoc did. Emily, are you on mute by chance?
Can you hear me?
Yes.
Okay. We are actually very passionate about taking care of people. And I think the very first step in taking care of people is keeping them safe. And I feel like I have a couple of decades in the quality patient safety area. And one of the things that you see pretty frequently is that if you ask 10 different people what patient safety means, you'll get 10 different answers. And this is pretty standard even with professionals in the industry. So the premise is always the same, and I think everybody's on board. Everybody wants to promote patient safety, but in order to do that, you really have to define that, because it's very different, in fact, significantly different from one setting of care delivery to another. So it's important that you clearly define what patient safety means to your organization specifically and to your setting specifically. And doing so will allow you to communicate this and to work within different disciplines and within different departments. And it allows you to make more meaningful decisions and have more meaningful discussion. And this is critical when rapid decision making is required for conditions that demand it, like this one. So next slide. With our accreditation process, URAC enabled and guided us to refine our policies and procedures, to take a look at them in a new light. The patient safety policy is a great example of a comprehensive policy that was used to help us quickly deliver on those promises we were wanting to keep. And we went literally from 10,000 visits a day to 20,000 visits a day. As Sean said earlier about that 10 years development in 2 months, that's exactly what happened. So we did have a short period in which wait times exceeded our SLAs, but within a week we were back to keeping those commitments and providing patient care on a huge scale. So this was due to the solid foundation that we developed in our accreditation process, and the safety elements that had been built into our system and our structure from the beginning. So it allowed us to be nimble and flexible, and we were able to quickly scale delivery and meet those demands. The enhancements we made during the accreditation contributed to our success, and that includes a time when stressors were really literally affecting all aspects of business. Most people don't really find the minutiae of policy discussion all that very exciting. I actually do, but I think Greg has some more entertaining content for us.
Yes. Next slide, please.
Before we do that, Greg, we've got a giveaway number 2. And the random name that my colleague Nick pulled is Rosangela Gundim. So Laura is going to private message you how we can get some swag out to you. And in the chat box, it's really important that we have these conversations and you all are learning from each other. So I'm posting questions in there, inviting you to tell us, how do you define patient safety? And what specific steps have all of you taken to enhance patient security? We may not get to all of our questions and comments here, but our staff, we've got a huge staff on the line here. As you saw, we are taking note of this. We'll follow up with you. It's letting us create some great follow-up tools. So let's pull up our next poll about, have you considered beginning the process of telehealth accreditation with URAC? No is not a wrong answer. We're not going to come after you by any means. We're just kind of curious where you are in thinking about this. And you'll see that coming up in the polling box. And as we do that, Greg, why don't you tell us a little bit about just getting ready and that gap analysis that one would need to start?
Hello, everyone. I'd like to chat briefly with you about how do you determine if you're actually ready to start the accreditation process? Or as I like to say, since it's baseball season, how do you feel a successful team? We start by saying, we want you to be successful and we want you to succeed. We begin with asking you to look at your operation today from a practical, clinical, and operational perspective. Look at your organization's policies and procedures. Learn what are the holes in the way you operate as compared to what we say you should be doing if you are to become an accredited organization. This will immediately lead you to 3 questions. How do you perform the assessment or gap analysis? What are the tools you need? And how do you use them? Assessing your readiness. The tools you need for the self-assessment or gap analysis are the URAC standards for telemedicine version 2.2, which include the standards at a glance and the detailed standards with the 3 provider modules. The standards at a glance identify the key program performance areas that you should be addressing in your policies and procedures. I compare them to your player's card when you're putting your line up together for the positions that you need to cover your baseball team. In the detailed standards, the key performance program areas are presented with specific information for the elements as to what you should be addressing in your policies and procedures. I would call these your game plan and scouting report. Oh, by the way, access to the detailed standards are provided once you have communication with your URAC business development executive indicating you are interested in becoming URAC accredited. And the provider modules, consumer to provider, provider to consumer, and provider to provider, they indicate the way care is initiated or the way you are playing the game, hitting, pitching, and fielding. Once you have completed the process of reviewing all of the key performance areas, you compare them to your organization's policies and procedures, and you identify the areas where you require attention and address them with appropriate upgrades. You are now ready to proceed with the accreditation or field your team. The accreditation process begins. You move through each accreditation stage, that is, the application, the desktop review, the validation review, the committee review, on your way to accreditation. And to achieve this, it's like circling the bases, tagging each bag as you head towards home plate and hitting your home run. Now back to Emily.
Thank you, Greg. At Teladoc, we've experienced a really rapid growth, including the recent acquisition of InTouch Health, which expanded and diversified both the organization in both delivery of care and technology systems. It also expanded our client base. And so we elected to go with URAC with the need to have a client program to meet them at the door with a quality program, a comprehensive quality program that was third-party verified with a reputable vendor. And URAC certainly meets all of those criteria. They're widely recognized as a quality leader in the industry. And so we felt confident moving forward that we would have an opportunity to learn from them, to identify gaps and opportunities to improve our own program and our own delivery of care, and be able to hand a comprehensive program over to the clients to show what we do to keep our patients safe and improve care delivery on a daily basis. We were also really eager to collaborate on standards that hallmark a quality telehealth program and improve the delivery of care in our communities. And the experience was overall positive. We have all, we achieved accreditation. We actually have all 3 modules. I'm very proud of that fact. and very happy to be working with URAC. So I'm happy to answer any questions if you have any.
Emily, this is Sean. Let me ask you a question. When this was all done, do you remember how much we charged you for consulting?
I do not. Don't ask hard questions, Sean.
Well, the reason why I ask you the question is because I want to highlight something.
You don't.
URAC is an independent third-party accreditor, and we don't sell consulting services. I think that's one of the things that distinguishes the accreditation process that we go through is we consider it to be an educational process where we educate you on our standards and we work with you to meet, to sort of turn in your organization's ways that you meet our standards, but we don't sell you consulting. And I think that there's a bit of a conflict of interest when you look at an organization and they want to sell you the consulting so that you can get the accreditation when it's all done. So we do not sell that. We're very proud of that. We are independent third-party accreditors, and we educate every group that we work with, but we don't sell them consulting. So that was what I wanted to lift out there, as I have killed anybody else from asking you questions there. That's look what I just did.
Sean, that was great. We want to make sure we've told you a little bit about our accreditation process. Sean's told you that we are independent. We do not sell consulting, but we want to know what questions you have. So, and Nancy's pointing out consulting is available in the community. Absolutely. Sean, can you talk a little bit about how organizations have done consulting, or Greg, how they've used those, speaking 100% independently of URAC, just what you've seen in the field?
I'll go first, just because I'm mouthier than Greg is. So I think that, when I spent about a decade at the Memorial Hermann System in Houston, Texas, and we had a telemedicine vendor that we worked with, and that was mainly from a technology platform and integrating it with our EMR system. And they came in and they helped us to set up the program. And there's a number of them out there, and I think that they do good work for people who are trying to figure out where to start. And I think that they're going to do a booming business. I think they have been doing a booming business with COVID and all that sort of stuff. And I'd say that if you work with a vendor, the vendor very often is going to bring in something like our standards at a glance and help you to sort of do the paperwork and those sort of things to put the program together. And that's fine. But at some point, if you want to be able to say that you didn't just put together, Sam's House of Consulting's version of telemedicine, but you actually put in something that was out there independent and verified, you have to go to the accreditation process. So I think there's good consulting groups out there. I think there's technology groups out there. I think we're seeing more people who are consulting now on a robust program with integrity, more so than how do I get this to connect to the camera on my doctor's desktop.
Absolutely. Thank you. And so, Greg, this question is probably for you. With the glut, and this comes from Christopher, with the glut of new telehealth companies, what are the requirements for them to form to even start? And I think, Greg, you may be referring us to some of the resources that we have. And if we can pull up, Laura, if you can add the standards at a glance file for telehealth, that'd be great. Or if you need me to do so, just let me know. But Greg, can you talk about that a little bit as our telehealth person, of what really needs to happen? If somebody is start soup to nuts, what do you have to do?
Okay, soup to nuts. Once you have determined that you are ready to proceed with accreditation, the issue becomes moving through the actual process of accreditation, doing the application, which involves the 5-month process that one goes to uploading information, and then moving from that into the desktop review, where they are working with the reviewer, responding to any information that they find lacking in their responses to the standards and readiness in their operation. From a perspective of what they need to form, I would recommend that they work with an appropriate vendor or platform organization to ensure that they had the appropriate technical pieces involved to have a secure platform for the delivery of the telehealth product, whether it be provider to provider, consumer to provider, or provider to consumer.
Thanks, Greg. Somebody else asked a question about virtual reviews. Obviously, we're in a time of COVID. Very few people are traveling. Sean, can you just speak about how we're maintaining our continuity of operations to make sure that we're serving our clients as best as we can, despite the fact that we're all at home?
Absolutely. So one of the things that we did recently, since I came to the organization, is we updated our values. And our first value, our core value for an organization, is we value people. And right now, with everything that's going on, we, along with the guidance from the federal government, suspended our on-site evaluations and reviews because we didn't want to interfere with care delivery. And so, for those organizations where we can do a virtual review and not have to come on site, we're doing those. We also don't want our people to travel and risk their own health as they travel right now. But CMS recently has announced that for certain programs, they're going to be resuming on-site visits. But we pulled all of that back. I'm one of the few people in the office today. Our office isn't even open here in DC because of the restrictions that we face in the DC area. And so when it becomes safe to resume those activities, we will be going and we will doing the reviews. We do desktop reviews, which are virtual, and then we will go on site to review programs and look at things. We do that a lot more with our pharmacy programs than we do with our other programs. But I just think it's important that we don't want to interfere with care delivery right now during this time. So everything we're doing is virtual, and we want to make sure that we're not interfering with care being delivered in different parts of the country.
Thanks, Sean. I appreciate you keeping us all safe. I think all of us staff on here do as well. A question's coming through from Tom McCarthy. He's the CEO of MCare. Welcome, Tom. And he wants to know, how does this differ from a SOC to type 2 audit?
So Tom is asking us a technical question.
Yeah, Tom is asking us a very technical question here. We love those.
Well,
even if we don't always know how to answer them, we have to get back to him.
Well, no, I'll give a little bit of an answer for Tom. Tom, when we do an accreditation audit, what we're doing is we're looking at the whole program. We're not limiting ourselves. And I know a SOC 2 doesn't limit yourself just to the technical, but we're looking at things like your credentialing program. We're looking at things like your technical program, your safety requirements, your patient identification, and those things. So it's an accreditation for a telemedicine program is different than a mostly technical SOC 2 audit.
Any other questions? We're happy to take in the chat box. We've got another poll to open up. We just kind of want to see if you're a little bit more interested in finding out a little bit more about URAC's telehealth accreditation program. As you can see, we've got a great team here. As Jeff just typed in the chat box here, he's got something here to help us easily understand the telehealth accreditation process. It's a great video there. And as we have that poll open, you can go to the polling box again. Tell us, are you interested in just learning more about our program here? While we're doing that, we have another question for you. And Sean, I'm just going to give this one to you because you are the question man of the hour. He said, is the URAC telehealth accreditation program specific to a telehealth organization? If so, what would you tell insurance companies that have providers in their networks that use telehealth? What's that message that we want to share?
So from that standpoint, a telemedicine accreditation program is around the complete telemedicine program. One of our telemedicine accredited organizations is an academic medical center down south. They deliver all types of care. It's not just limited to organizations that just do telemedicine. As a matter of fact, a number of the organizations that we have worked with recently have said, we always had sort of this niche of telemedicine that was being done by certain departments within our organization. We now recognize that we have to have a robust platform that covers our entire organization, and so they're coming to us for accreditation. And so, academic medical centers, small hospitals, organizations that are just doing telemedicine, they all are coming to us and they're saying, we recognize that what we're doing may be 90% of everything we need to do, but we don't even know the 10% that we don't know. So that's why going through accreditation helps you to sort of flesh out what is a robust full program using the best practices from people all over the country and learning from the experts such as Teladoc, which has done an outstanding job and really has stepped into the fold during this time of crisis.
Thanks, Sean. We've got one last giveaway, and that is going to Christopher Koslow. So Christopher, Laura Wood's going to send you a private message. Our team is open here for any other questions in the chat box. I'm not sure if we can open the voices, but if we can, we'd love to get your voices. And our team is going to hang out here in the chat box. We are done with our formal presentation, but we'd love to hear from you in the chat box. We'd love to just kind of have this time as kind of an open room, almost as if we were leaving a physical room. So like I said, our formal presentation is done, but please hang out, ask questions in the chat box, see what your peers are asking. We've got staff here. Thank you to all of you for participating today. Thank you to the awesome URAC staff who's been here. Thank you for your great questions. And Sean, thank you for putting your email in there in that chat box there. We know that you're always reachable and you love to talk to clients and hear from their experiences and tell us how we can help them.
Yeah, I chose not to put my cell phone because, that just gets a little bit busy sometimes. But my email here at the office, and like I said, I'm sitting in the hot office here in DC today. But, I think our organization really recognizes that there's a chance for us to share best practices and to help set best practices as we go forward with this. And it's partners like Teladoc that have contributed so much to the standards and will be working with us on the next version of the standards, because what used to be telemedicine isn't what telemedicine is going to be from now on.
Sean, I know in your video you talk about what we're even looking at with telemed going into the 2020 election.
Oh yeah, absolutely. I mean, the fact that healthcare, healthcare was a focus prior to COVID as an expense, and now it's being focused upon as, drugs. At the end of last year, people were talking about drugs being so expensive, and now the drug companies are acting as saviors for medications and for vaccines. But as we go into 2020 and we look at how people will be campaigning on health and protecting our country and our populace, it's a different conversation. And depending upon how the election turns out in November, we're recording this on June 5th, and things change every few days here in DC. But there'll be some new rules. There could be new people involved. There'll be new lessons learned and new priorities that happen with every election, both federally and at the state and at the local areas. So I would ask you, if you feel strongly about telemedicine, be an advocate for telemedicine. Talk to your representatives and make sure that they understand how telemedicine can be done and done right and help people. And that's what we're going to be doing here in DC, and advocating on behalf of providers and patients and consumers, so that telemedicine is something that can really serve people and not just offer a new shiny object for us to spend money on.
Sean, you have become the subject matter expert of the day here. So there are more questions coming in for you, and this makes me extremely happy. Clarissa Clarkson is asking, do you know how insurance companies will proceed moving forward from the pandemic? And I know you're not a seer into the future, but do you expect that they'll continue to cover telehealth for behavioral health? I know we're seeing some of that be covered, some of it's state by state, but what's your predictions?
So it's interesting because we also offer substance use disorder and behavioral health accreditations, and we had already been incorporating telemedicine into our behavioral health standards for programs. And when we look at what we're doing for the updating of the telemedicine standards, we have a couple different payer organizations that are contributing people to the updating of standards. And I believe that they recognize that telemedicine is perfectly appropriate, especially around some areas of behavioral health, for addressing the network adequacy issues that people face for getting behavioral health care. So I think that some of those are going to stick around. Again, everybody is sort of the payers are all sort of dragging their feet watching the federal government, because the federal government very often acts as the steward for allowing things to happen. And the fact that the federal government is allowing it in the Medicare Advantage space means that it's probably going to stick around in some other areas. And I would expect behavioral health to be a place where it's perfectly appropriate.
Awesome. Thank you. Very happy to hear that. Chicho James is asking, can a tech company who white labels a platform for hospitals and clinics get accredited? Maybe if not through telehealth, maybe through one of our other programs?
Well, I would say that if you're a tech company who white labels the platform, and you're taking your policies and you're taking your procedures and you're taking your platform, I would say that there's probably a path for you to either be accredited or look at what we're doing for our vendor certification programs. Vendor certification programs are when someone provides basically all of the tools to a provider, but doesn't provide the actual last step of the provider interaction, and that's more sort of a vendor certification program, which we've talked about. But if you're doing full soup to nuts and you can check all the boxes and everything that's required for a telemedicine accreditation, then we are open to it, because we see that as a chance to improve the care that's being delivered. You don't have to, if you don't have the providers, it's going to be tough for you to check all the boxes, but if you're bringing the providers to it also, then you should be able to qualify.
Thanks, Sean. I think we're getting questions. I don't see any more coming in the chat box, but we are happy to field them. We know there's a little bit of a delay as people hear your response. We've got a little bit of I guess what we call a radio delay. But please continue to ask questions in the chat box. You have the URAC team here for a couple more minutes. We are happy to make the connections here. Okay, so here's a good one for us. And this might be a great question, but how is the telehealth accreditation billed? Is it per provider or per organization? I have a feeling that's where it breaks down between the three types. But Greg, can you speak to that actually?
Yes, please. The way we price our quotation for telehealth accreditation, it's based upon a couple of factors. One, the type modules or the number of modules you have, and the lines of service. For example, if you're doing a provider to consumer and you have one line of service, that cost is $10,000 for a 3-year accreditation. And then it bills accordingly. If you have 2 modules of service and one line of service, then you're looking at a cost of $14,000. But it is something you can better discuss, particularly about your organization and the way you are providing services with your business development executive that covers your area of the country.
The other thing that I would add to that is that when we look at the pricing of accreditations, we're going to have to be updating that because of the fact that as we update our standards, we're going to be looking at everything that we have learned based upon the experience everyone's gone through with COVID. So I would not be surprised if we have a different model going forward with how we price these things. But the other thing is that there is the price of accreditation, and then there is the discussion that you have as you go through the contracting. So I would just say that don't let the price get in the way of it. We think that the pricing that we had before was quite reasonable, and we were successful with that pricing in the marketplace. Again, you won't be paying for consulting in addition to the price of the accreditation. So, but I expect we're going to update that with the update in our standards that we're going to be going through shortly with our best practices group that's going to convene on updating the standards.
Thank you, Sean.
Sean, I also want to tap into something here because I noticed we had a few international clients on our call, and I hope they're hanging out here. But can you talk a little bit about what that means with international accreditation and how that's happening, especially with telehealth now?
That's actually really interesting. We had restricted ourselves to U.S. accreditations for several years, and the fact is that because we were recognized as the biggest telemedicine accreditor, we started getting people reaching out to us from places in Africa, from in Europe, in Asia, and saying, we'd really like to be accredited. And so because of that interest, we actually had to write up a new agreement because our standards are written by, that you're going to adhere to U.S. law. And we had to go and we had to say, all right, let's change it. And so we actually offer an international telemedicine accreditation program that is reflective of the jurisdictions and locales where providers may operate, and that's simply us responding to the market because if you're setting the standard in the US, other parts of the world go, that's a pretty good standard to try and hit. So we're thankful that people have recognized the role that we play in the US market and invited us into their countries.
Sean, before we go, is there anything else you want to highlight about URAC? Anything for some people who may be new to us today, just before we officially close out?
Sure. The real short elevator speech. URAC
Absolutely.
is an independent third-party accreditor that has existed since 1990. We were actually founded on Valentine's Day, 1990. We started out because of the need for utilization review and the fact that people said, you've got the payers on one side, the providers on the other side, and the consumers don't know who to trust. And we're that independent third-party accreditor. We offer accreditations across more than 30 different programs, and we do not sell consulting. We believe that we help people to set a higher standard and to deliver the highest value of care that they can. We believe that you can use the URAC Gold Star to distinguish yourself in the marketplace. And as long as we can find ways to take better care of more people, then we're happy at the end of the day.
Thanks, Sean. It was great to be with all of you today. Thanks so much for hanging on for some additional conversation. We love chatting with you. We're going to close the webinar room now, but I'm going to ask that staff and presenters stay on for just a brief moment. Thanks so much.